Government at all levels have been called upon to invest critically in the health and education of its populace, especially children, so as to attain its economic height and maximize the potential of its demography. The co-founder, Action Health Incorporated, Dr. Esset Usem, made this call at the sensitization workshop organized in conjunction with UNESCO for educational stakeholders and policymakers in Lagos State. He said education, health, and well-being of children, if prioritized, will transcend into development for the nation.
We want government to put resources where it matters the most. The health and well-being of our young people is the most critical investment that our nation can make. Knowing fully well that Nigeria in the next 20-30 years will become the third largest country in terms of population in the world, and over 35% of that population will be young people below the age of 15. So, and if we don't do what is most appropriate now, then we will not be having what is called the dividend of that demography. So it's called demographic dividend. So we need to invest in their health, we need to invest in their education and their well-being.
Once this information is passed to these young ones and they are able to inculcate it and take it in, definitely it's going to have a positive effect on their behavior, on their decisions, and on their lifestyles. And even the family will be good for it. And we think, because it's for some years now, the FNH has been on, we have been talking about it so many years. I remember when we started this, children began to take decisions, healthy decisions. They stopped all the various kind of vices that were going on in the school then.
Speaking on the workshop and training, participants at the workshop speak on the impact of the training on teachers, pupils of Lagos State.
Train some of our students, and at the same time it has taught our students physically, mentally, socially, and emotionally. They'll be able to address the issue of gender-based violence.
What it does is to enhance the skills of our children so as to be able to cope with the various challenges that they come across in our society. Yes, it came about as a result of the rampaging HIV and AIDS menace in our society as at the period. But today, a lot of the children that have been privileged to have passed through those teachers that have been trained, they are all in important places today, and they have been able to know how to be able to go about living a normal life.
Despite the contribution of NGOs such as Action Health Incorporated in supporting government at all levels to combat the deplorable state of health in Nigeria, the nation's health sector still lag behind in terms of development as a result of low investment in health infrastructures and human capacity development.